80 रु अधिक मृत्यु होगा पर विश्व स्वास्थ्य संगठन जरूरीकालीन स्थिति घोषणा करिছে 1976 मसीहा पर प्रथम थर पर कंगोरे ए भाइरस देखाजिबा सहित प्राणघाती साजिছে संक्रमण बढ़िबारु मृत्यु सहित कटकणा भी बढ़िबारे लागिছে जेमिति कोरोना समय कटकणा लागुला ठीक सही परे एबोला पई आफ्रिकीय देश में कटकणा बढ़ुছে दक्षिण आफ्रिकार माड़ुछि एबोला कंगो और उगांडा सबुठु अधिक आक्रांत चिन्हट 80 रु अधिक प्राणहानि होइछि देश में जरूरीकालीन स्थिति घोषणा करा जाइछि एपटे सतर्क रहिबाकू विश्व स्वास्थ्य संगठन भी सतर्क कराइछि एबोला संक्रमितंकर बांती दुर्बल अनुभव और मुंड बिंधा हुए प्रबल ज्वर मांसपेशी जंत्रणार लक्षण मध्य देखा मिले संगरोध संक्रमित रहिबाकू पड़े WHO कहिछि एहा कोरोना भली स्थिति नुहे साधारण लोकंक पई एहा खूब कम विपदपूर्ण लोके कोविड सह एबोलार तुलना न करंतु संक्रमण रोकिबा पई व्यापक व्यवस्था करा जायछि
No, it does not change. There are already 4 or 5 types of Ebola viruses which are circulating. The most common and previously the one which is causing maximum mortality was Zaire strain, and that was associated with almost 80-90% mortality. A vaccine has been developed for that, and there is some monoclonal antibodies for treatment are also available. But for this particular virus, BDB virus, there is no vaccine available, although this disease is less severe. The mortality is little less, but still it is 30 to 50%. And there are no other therapeutic options available. Therefore, there is a lot of concern about this virus. So this disease starts like a common viral illness, like fever, weakness, body aches. But the important thing is, as the disease becomes severe, bleeding manifestations can occur. Bleeding can occur in almost every organ, and the person can die because of these hemorrhagic manifestations. The important point is that till the time person gets symptomatic, the virus does not spread. One patient spreads the virus only when they get symptomatic. And incubation period is anywhere between 2 days to 21 days. Now, during this incubation period, the patient is not having any symptoms, and it is difficult to detect them.
So there is no therapeutic for this virus. I mean, one can try symptomatic addressing and some antivirals that may partially work, but there is no approved therapy for this. That's why it's a matter of concern. So, but having said that, I think the focus should be more on prevention, because once person is infected, the chances of severe clinical features are very, very high. But considering unlike other very infectious viruses, this virus spreads only through direct body contact. That means through body fluid. It may be vomit, it may be any body fluid. So that is why the chances of this spreading like SARS-CoV-2 or something is not there. But wherever it is there, because of the physical contact or needle contamination and those sorts of things, and it can come in the system like through urine, fecal samples, and vomits and those things. So, and that way it can come into the chain, and some people may get infected. But the proper care is there, then it's a fairly manageable thing.